You might be doing everything right, eating balanced meals, staying active, and exercising regularly. But what if one specific exercise you're doing could silently increase your risk of stroke? Yes, even movements that seem safe can turn dangerous after the age of 60 if they're done the wrong way, at the wrong time, or without proper awareness. And the surprising part, many people have no idea they're putting themselves in harm's way. As a neurologist, I've seen how our bodies respond differently with age. Blood pressure shifts more quickly, arteries become more fragile, and certain types of strain can put sudden, dangerous pressure on the brain and blood vessels. Sometimes all it takes is a sudden movement, a bad angle, or even holding your breath at the wrong time for things to go wrong. I've treated patients who were simply trying to stay healthy, but without realizing it, they were doing something that pushed their brain past a safe limit. In this video, I want to show you exactly what to watch for. You'll learn how one seemingly harmless exercise can spike your stroke risk overnight, and how to modify your routine to keep your brain safe, while still getting all the benefits of movement. Let's start with a common activity that can be far more dangerous for older adults than most people realize: rapid neck twisting. Many people do it to loosen up stiffness, a quick side-to-side turn, or a full rotation, just to feel that release. But inside your neck are two crucial blood vessels, called the vertebral arteries. They feed oxygen-rich blood directly to your brain, especially the areas that control balance, coordination, and vision. When you twist your neck forcefully or snap it in a sudden motion, you can compress these arteries. In rare but documented cases, the twisting can even cause a small tear in the artery wall, something doctors call a vertebral artery dissection. This can reduce or block blood flow to the brain and trigger a stroke. I remember consulting with a patient in his late 60s who had a habit of doing aggressive neck rolls every morning. One day, just minutes after stretching, he felt sudden dizziness, blurred vision, and trouble speaking. Imaging later showed that his neck motion had injured one of his vertebral arteries. You might think, that would never happen to me. But as we get older, artery walls can lose flexibility, making them more vulnerable to stress. What feels like a simple stretch can put more pressure on them than they can handle. Here's the safer approach: move your head slowly and within a comfortable range of motion. Instead of fast or forceful twists, try gentle side-to-side turns and slight up and down nods. Pair them with deep breathing so your muscles relax without sudden strain on your vessels. If your neck stiffness is persistent, it's worth checking with a physical therapist who understands how to design mobility exercises that protect your circulation and spinal health. And remember, staying safe isn't about avoiding movement altogether. It's about knowing which movements need extra care as your body changes. The next risky movement often hides in exercise routines designed to build strength. But for people over 60, it can unexpectedly raise stroke risk. Holding your breath during heavy lifting. When you lift something heavy, whether it's a barbell at the gym, a bag of potting soil, or even a large laundry basket, there's a natural tendency to hold your breath to brace your core. This is called the Valsalva maneuver. While it can add stability, it also creates a sudden spike in pressure inside your chest and head. For younger adults with resilient blood vessels, the body usually tolerates these short bursts. But as we age, arteries become less elastic and more prone to small ruptures or blockages. That rapid rise in blood pressure can strain the delicate vessels in the brain, sometimes enough to cause bleeding or cut off blood flow. I once treated a retired carpenter who enjoyed keeping fit with weight training. One day, mid-rep on a heavy shoulder press, he felt an intense pounding in his head, followed by blurred vision. His blood pressure had spiked to dangerously high levels, and scans revealed a small brain hemorrhage, likely triggered by the breath-holding strain. The fix is simple and life-saving. Keep breathing through the lift. Exhale as you push or pull. Inhale as you return to the starting position. Choose weights that are challenging, but still allow you to maintain steady breathing and proper form. And if you ever feel lightheaded, stop immediately. Another overlooked danger comes from certain yoga poses, specifically inversions like the headstand or shoulder stand. While these poses are celebrated for their calming benefits and improved circulation, they can have the opposite effect for older adults. When your body is flipped upside down, blood rushes toward your head, increasing pressure inside your skull. In younger, healthy blood vessels, this is usually harmless. But in older individuals, especially those with hypertension, that extra pressure can overwhelm the system, stressing the arteries that feed the brain. Neurologists have reported cases of vision problems, severe headaches, and even small strokes occurring after unsupervised inversion poses in seniors. One woman in her late 60s told me she practiced shoulder stands daily for brain health. After weeks of doing this, she began waking with throbbing headaches and occasional dizziness. When she stopped inverting, her symptoms vanished. A safer alternative is the legs up the wall position. It gently boosts circulation from the lower body without forcing excessive blood flow to the brain. Plus, it can be deeply relaxing, making it perfect for winding down in the evening. And speaking of timing, when you exercise is just as important as how you exercise. High-intensity workouts late at night can keep your nervous system on high alert long after you've finished, raising nighttime blood pressure and putting strain on your cardiovascular system when it should be recovering. If you enjoy evening activity, swap intense cardio for slow walks, gentle stretching, or balance work. Save the more demanding workouts for earlier in the day, when your body is better equipped to handle them. The bottom line: many movements that seem healthy can become risky if performed with too much force, the wrong technique, or at the wrong time. With small adjustments, you can keep the benefits of exercise while dramatically reducing the danger to your brain. One of the most common core strengthening moves, the sit-up, can be more dangerous than it looks when done too quickly or with poor breathing habits. When you perform rapid sit-ups or crunches, you increase pressure inside your chest and abdomen. This pressure briefly restricts blood flow to the brain, similar to kinking a garden hose. For older adults, whose blood vessels are less flexible, this restriction can be more pronounced, sometimes leading to dizziness, lightheadedness, or in rare cases, a fainting episode. A man in his early 70s once shared with me that he'd been doing 100 sit-ups a day, challenged to stay fit. Within a week, he began feeling disoriented after each session. His doctor explained that the speed, combined with breath holding, was interfering with cerebral blood flow. Switching to slower, controlled core exercises solved the problem. Safer alternatives include pelvic tilts, seated marches, or standing knee lifts, all of which strengthen the core without the rapid internal pressure spikes. Remember, exhale with effort, inhale on release, and never rush the motion. Another surprisingly risky spot for seniors is the treadmill, especially when running at higher speeds without holding the side rails. As we age, reaction times slow and balance becomes less automatic. On a fast-moving treadmill, one slight misstep can lead to a fall, and if you hit your head, the trauma can trigger a cascade of brain-related complications, including stroke in those with vulnerable blood vessels. I once saw a fit, active 68-year-old man who prided himself on jogging hands-free every morning. One day, a minor slip caused him to fall hard, leading to a concussion. His doctor later explained that holding the rails, even occasionally, might have prevented the accident entirely. If you enjoy treadmill workouts, keep your pace steady rather than fast, and don't hesitate to grip the rails if you feel even slightly off balance. You can also raise the incline for a cardiovascular challenge without the risk that comes with high speed. Then there's the plank, a favorite for building total body stability. While planks can be excellent for posture and strength, holding them too long, especially while holding your breath, can drive up blood pressure and reduce oxygen delivery to the brain. In one study, older adults performing prolonged isometric holds like planks experienced significant spikes in systolic blood pressure. One of my neighbors used to time herself in a plank, pushing for 2 minutes or more. She began to notice headaches and chest tightness after these sessions. When she cut her hold time in half and focused on steady breathing, the symptoms disappeared. The solution: keep planks short, 20 to 30 seconds, and focus on deep, even breaths. You'll still get the strengthening benefits without overloading your cardiovascular system. The key pattern here is clear. The risk often isn't in the exercise itself, but in how it's performed. The speed, the breath control, and the body's position can all affect brain safety. Making these small adjustments means you can keep your favorite moves in your routine without compromising your health. And there's still more. Even ordinary daily motions can cause sudden drops in blood pressure that raise stroke risk if we're not careful. One movement most of us do dozens of times a day without thinking is standing up and sitting down. Simple, right? But if you do it too quickly, especially in repetition, it can set off a chain reaction in your body that leaves your brain briefly undersupplied with blood. This effect, called postural hypotension, happens when your cardiovascular system can't adjust fast enough to the change in position. In younger people, the body compensates almost instantly. But in older adults, that adjustment can be delayed, sometimes by several seconds. In that short time, you might feel lightheaded, off balance, or even faint. And if you lose your footing, the risk of head injury is significant, which can itself increase the chance of stroke or other brain complications. I remember a friend in his late 60s who added fast-paced squats to his morning routine, thinking it would help keep his legs strong. Within days, he was having dizzy spells that left him shaky for hours. Once he slowed the pace and paused between each movement, those symptoms disappeared. The safer approach: rise slowly, take a breath, and give your body time to adjust before moving again. If needed, use a sturdy surface for balance. It's not a sign of weakness, but of smart, injury-preventing strategy. Another everyday habit with hidden risks is bending forward quickly, like picking something up from the floor in a hurry, or tying your shoes without bending your knees. When you bend forward suddenly, blood rushes toward your head. For older adults, the cardiovascular system may not respond quickly enough to balance that pressure change, causing a rapid drop in blood pressure when you straighten up again. This can leave you dizzy, disoriented, or unsteady, and it's easy to see how that could lead to a dangerous fall. In some cases, that brief drop in brain blood flow can also trigger a neurological event in people with already compromised circulation. A man I once consulted with described getting dizzy every time he grabbed something from the bottom shelf of his pantry. Once he learned to bend at the knees, move slowly, and brace himself with one hand, the dizzy spells stopped entirely. It's a reminder that small adjustments can have a huge impact on safety. Even common movements we've done all our lives need rethinking as our bodies change with age. Both of these examples share a theme. The danger isn't about not moving, it's about controlling the pace and giving your body time to adapt. That principle also applies to more structured exercises. Sometimes it's not the difficulty of the movement that poses the risk, but the way it's timed and the lack of recovery between repetitions. This is why awareness and technique matter as much as strength and endurance, and why a smarter, not harder approach is the real key to staying active after 60 without putting your brain at risk. The final exercise on our watch list is one that's often praised for building strength and stability: long-duration static holds like wall sits. Wall sits can certainly challenge your leg and core muscles, but holding them too long, especially without proper breathing, can create the same internal pressure spikes we've discussed with other exercises. This pressure can momentarily restrict blood flow to the brain and raise blood pressure at the same time, a double strain for anyone with cardiovascular risk factors. I met a man in his mid-60s who used wall sits as part of his home workout. He would push through the burn for up to 2 minutes, thinking it was a sign of progress. But after a few weeks, he began experiencing pounding headaches during the hold. His doctor suspected the combination of muscle strain and breath holding was overstressing his vascular system. The safer approach: shorter holds, 20 to 30 seconds, with controlled breathing, alternate with gentle walking or light movement between sets to keep circulation flowing freely. This is a good point to step back and look at the bigger picture. None of the exercises we've discussed are bad in themselves. In fact, many can be part of a healthy, balanced routine if they're adapted for your body's needs. The real issue is awareness, knowing how certain positions, movements, and breathing patterns affect your circulation and brain health as you age. It's worth remembering that after 60, the goal of exercise isn't to push harder than everyone else in the room. It's to move with purpose, protect the body you have, and maintain the independence you value. One of my patients, a 72-year-old former marathon runner, put it best: "I stopped trying to beat my old times and started focusing on keeping my body ready for the life I want to live." By adjusting his workouts to emphasize safe movements, steady breathing, and better recovery, he found he had more energy for the things that mattered, like hiking with his grandchildren and doing yard work without worrying about injury. This is the mindset I want to leave you with. You can stay strong, mobile, and independent without pushing your brain and blood vessels to the breaking point. So here we are, having walked through exercises and everyday movements that, if done without care, can put more stress on your brain and circulation than you might realize. The goal here is not to scare you away from activity. In fact, staying active is one of the most important things you can do for brain health at any age. But after 60, The way you move matters just as much as the fact that you move. A good rule to follow is the 3 Ps: pace, posture, and pressure. Move at a controlled pace, maintain good posture to support blood flow, and avoid holding your breath or straining in ways that spike internal pressure. Pay attention to warning signs like sudden dizziness, blurred vision, headaches during or right after exercise, or feeling faint. These are signals from your body that it's time to stop and reassess your technique, intensity, or breathing. If you're starting a new exercise, try it slowly and see how your body responds before increasing duration or intensity. And when in doubt, get clearance from your healthcare provider, especially if you have a history of high blood pressure, heart disease, or vascular issues. It's also helpful to mix your activities. Include a balance of strength, flexibility, and gentle cardio, so no single system is overloaded. Variety not only keeps your workouts interesting, but also reduces the repetitive strain that can happen when you do the same movement over and over. I've seen too many people give up on exercise entirely because of one bad experience: a fall, a dizzy spell, or a sudden spike in blood pressure. The truth is, with a few adjustments, you can keep moving in ways that are safe and brain-friendly for decades. Remember, the purpose of exercise at this stage of life isn't to keep up with younger people or to push past every limit. It's to keep your body and brain working together so you can keep doing the things you love without fear. So as you think about your own routines, ask yourself, am I exercising in a way that challenges me safely, supports my brain health, and respects the changes my body has gone through? If the answer is yes, you're on the right path. And if this video has helped you see your workouts in a new light, I hope you'll share it with someone who could benefit from the same knowledge. A simple change in how we move can be the difference between years of independence and a preventable setback. If you found this information helpful, hit that like button. It helps the video reach more people who need it. And make sure to subscribe to Senior Health Studio for more science-based tips to keep you strong, sharp, and safe after 60. Turn on notifications so you never miss a new episode. And in the comments, let me know, what's one movement you're going to adjust after watching this? Here's to moving smarter, protecting your brain, and living life to the fullest every single day.